Upon arrival, you're told by store security that a young man was walking through the store when he apparently passed out and started seizing. As you approach the patient on the floor of the store, he is still experiencing tonic clonic movements. Dispatch. You are called to a department store for a patient who is passed out.
Okay, so I'm wearing proper PPE. Is my scene safe?
Yes.
Alright, so nature of illness sounds like a seizure from convulsions or convulsive syncope of sorts. One patient, right? One patient?
Yes.
Okay. I would go ahead and consider calling ALS. I would go ahead and give them a call. I can always cancel them later if I don't need them. I would go ahead and do C-spine because we don't know if he hit his head whenever he fell or hurt his neck. My general impression is that I have a man laying on the ground convulsing. Is he responsive at all, verbal or painful stimulus?
Unresponsive.
Okay. Chief complaint is that he is convulsing and unconscious or unresponsive. And then moving on to ABCs, airway and breathing.
Is open.
Okay. Does he have equal chest rise and fall?
Breathing none at the moment. Hard to see rise and fall at the chest.
Okay. So am I able to get SpO2 on him?
Unable to obtain with seizure.
And can I hear lung sounds?
Unable to hear.
Okay. I want him on oxygen therapy, especially since I can't get an SpO2 reading. 15 liters per minute non-rebreather is what I would go ahead and do. Just make sure that he's getting oxygen. Circulation.
Radial pulse, strong and equal.
Okay, what's his pulse count?
87 beats per minute.
Okay. What?
100 beats per minute, sorry.
Okay. 100 beats per minute. What's his skin look like?
Pale, warm, and moist with some cyanosis noted in the lips.
Okay. And is he bleeding anywhere?
None.
Okay. So, by the way, I forgot to say it, but I would be moving everything out of the patient's way since he is still convulsing. I would want to make sure there's nothing nearby that can hurt him. I would probably have my partner do that while I'm working on everything else. Rapid transport, load him up and get him out.
The patient stopped seizing after 2 minutes of being on the scene.
Okay, does it say if he's answering questions correctly?
It does not say.
Okay. So I would urge him to go to the hospital. So he's coming with us. History of the present illness.
He is unresponsive.
But okay, so he's still unresponsive after he's done convulsing?
All it says is the patient stopped seizing after 2 minutes of being on the scene.
Okay. Alright. So then load him up and get him out. So we're in the ambulance trying to either meet ALS on the way or get to the ER, whichever happens first. So we can't really obtain, well, what was the onset? Because we got called for OPQ or ST.
Approximately 10 minutes.
Okay. And is the rest of it not there? Is it unattainable or whatever? Unknown.
undetermined, and then NA.
Okay. Time, is that on there?
Approximately 10 minutes.
Okay, so we don't know the quality, severity, provocation, or radiation. So then moving on to sample, signs and symptoms. He was convulsing and he was unresponsive. Does he have...
Witnesses state that the patient fell to the ground and began seizing. He's incontinent of urine.
Okay, so he urinated himself. Does he have any... Does it say if he has a medical tattoo, necklace, bracelet?
Medical alert bracelet states epilepsy.
Okay. We don't... I assume we don't know about allergies or medications.
Unknown.
Okay. Pertinent medical history is epilepsy. And then we don't know last oral intake.
Unknown.
And events leading up to.
Walking through the store when he fell and began to seize.
Okay. So the system that we're assessing is neurological. I want to take his blood pressure now. I want to do his vitals.
Blood pressure 150/88.
Okay. Pulse is 100. What's his respiration rate?
4 to 5 per minute.
Okay, that's super low, so I want to get positive pressure ventilations going with supplemental oxygen, 15 liters per minute still. Or not still, I haven't done anything, but 15 liters per minute. Does it say the quality?
No.
No? Okay. If I look at his pupils.
Very sluggish but equal.
Okay. Sluggish but equal. And then skin still.
Remains pale and
Cyanotic. Okay. My field impression is that he's tonic-clonic seizure or grand mal seizure. The proper interventions would be the positive pressure ventilations, since his respiration rate is so low. Get him either to ALS or to the emergency room. I would reassess every 5 minutes. And then trading him off, I would say that upon arrival this guy was having a seizure, and pupils were sluggish, and like for response they were sluggish. 100 beats per minute for pulse, 150/88, and then 4 to 5 breaths per minute. We gave him positive pressure ventilations. That's it, I believe.